Good morning. Welcome to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens, and joining me in the studio this morning is Dr. Mike Rogers. Good morning.
Good morning, Adam. How are you?
Good. Thank you for being here, and welcome to this great program telling listeners a lot about what you do at Complete Health Dentistry, celebrating 25 years, I understand.
Yes, we are.
It was 25 years ago today that you finished dental school and got into the practice, or how did that happen?
Actually, no. It's 25 years in Honesdale that we've been practicing. I've been practicing dentistry now for over 30 years.
And where did you start?
Where did I start? In Allentown.
Allentown, PA. And what brought you to the Honesdale area?
Family.
Okay. It's a beautiful location, isn't it?
It is.
And as a dentist, you have actually won the Happy Award winner for Best Dentist in Northeast Pennsylvania now 3 times. Is that correct?
Yes, 3 times. We're a 3-time award winner. Thank you very much, Northeast PA.
And one of the things that we're here to talk about this morning as we get started here this Saturday is what you mean by the phrase complete health dentistry. What is a complete dental health practice? We're also going to be talking about what sets you apart from other dental practices. But first, I just want to have our listeners have a chance to get to know you, Mike. So maybe you want to tell us a little bit about where you grew up, what made you decide to get into dentistry, and then how the practice has been going.
Those are long-winded questions for me. I could certainly start. I grew up on Long Island. I spent most of my childhood here in Northeast Pennsylvania on my grandfather's farm. I met my wife, who is from South Canaan area as well, which is local here. And we decided to move back to this area because of my family, her family. And that's pretty much it on that end. What made me get into dentistry, if you name, my mom's family is so large that if you name a profession or something, from a nuclear rocket scientist to medicine, there's someone that does it.
Wow.
And so, except for dentistry. And I love being with people and helping people. I love working in the small, intricate things, the details that dentistry affords me to do. And so it was a perfect fit.
Now, a little bit about the experience of dental school. I'm curious, where do you find a dental school? How do you choose one? And what kind of training, what level of hands-on activity is involved in the very early stages of becoming a dentist?
Well, choosing a dental school for me was a long road as well. I decided early on in my undergraduate career, freshman year of undergrad, that I wanted to be a dentist. And so that's what I focused my undergraduate studies on, is how to get into dental school. You take exams to get into dental school, and then you apply just like you would to any college. You apply, and then whoever accepts you, you choose just like you do on an undergrad. You go visit the school and you decide what to do.
And what's the program length typically? Does it vary from school to school?
Usually it's 4 years in addition to the undergrad. So, it's a total 8 years of school, plus if you wanted to specialize.
And the choice to pursue a specialty, is that a choice you would make in the 4-year dental school once you're sort of in it, or after you've finished it? How does that work?
I've had friends that did both. Ones that went right through and just continued on with their studies, and others who have gone back to school for specialties.
And I'm certain, and we'll talk about this a little later, though, that once you finish school, there's lots of opportunities to improve your skills, be certified in various other techniques and technologies. Does that sound right?
Exactly. There's things that we do in our dental office that most general dentists, most dentists as a whole, don't do as themselves. They would refer out to specialists or someone else that was more capable of doing it.
So once you finished dental school, where did you go to dental school? Or was it?
I went to school in Chicago, Loyola, Chicago.
Wow. And when you finished, do you jump right into a job? Do you kind of do an internship? What's next right after graduation?
These are great questions. Once again, it varies by the person. I've got friends that went into a residency program in a hospital. I've got myself, I went into private practice working as an associate for someone, which was my introduction to the different specialties, because it was a large group practice in Allentown. And so all the specialists came right into the office, and I was able to sit and watch hands-on surgeries, gum surgeries, oral surgery, different restorative techniques by specialists and orthodontics as well.
So you really had a chance to see the whole spectrum of dental services in one location at your first dental job. Is that
correct?
Wow.
Correct.
And then from Allentown, you moved right to this neck of the woods in Honesdale.
Right to this neck of the woods in Honesdale. Set roots here. The kids were born and raised here. And
roots, no pun intended. Sorry, I'm going to call every dental pun I can here for the next half an hour or so. Okay, so you set your roots down here in Honesdale. The kids went to school, and you started your own practice.
Well, I bought an existing practice.
Okay.
That had been here. Boy, I don't even know how many years they've been. 20 years prior, I believe,
wow.
Before I bought it.
Okay, and so Mike Rogers takes over the practice about 25 years ago now?
Yes.
And since then, I have not been here the whole 25 years, but I understand it has grown by leaps and bounds.
Yes, it has. It's a testament to my team as a whole, because patients keep coming back. I believe they love and trust us.
I've seen the practice myself. I've spent some time in there. It's warm, it's welcoming, it's inviting, it's very well decked. Your staff is really friendly. You've clearly done a great job, sort of lining everything up, pulling everything together, and making a great practice for really all the dental services people need. And when we say complete health dentistry, we're going to talk a little bit later on about what you really mean by that. But I got just a taste of it the other day. I came in for a consultation, and it's a real tip to tail. It's the whole body. Is that right?
Yeah, it is. The mouth is the gateway to the rest of the body. I use an example, and I've talked to veterinarians before. But if you bring your pet to a veterinarian, the first place they look is right in the mouth. They're looking for inflammation, disease, things like that they can see because their patients can't talk to them. But yet that's a window to the rest of the body. What we do is the same thing. We look at the mouth, and then we address dental problems in a fashion that we believe will help the rest of your body.
We've got folks who are patients of yours who are just brand new for the first time, but you've had folks who've been coming back to you for years and years now?
Yes, we've had patients that have stayed with us for 25 years.
And maybe their kids are coming in to see you now.
Yeah.
This is Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Joining me in the studio is Dr. Mike Rogers himself, celebrating 25 years in the Honesdale area, but as we've learned in dentistry for several years beyond that. Mike, how many folks do you have working for you at the practice right now?
8.
Okay, it's a good team.
Yes, it is. It's a wonderful team. Your family.
Hygienists, receptionists, sterilization specialists. What else?
Yes, front desk, financial coordinators, treatment coordinators, office manager.
So really, it takes a whole team to make this happen, and they work very closely with you. And you team meetings every day or every week.
We do a morning meeting just to make sure we're all on the same page with every patient that we're going to be seeing today, and so that everybody is aware who is coming in. And then once a week, we sit down and we go through any changes in what we're going to be doing, any help that we need. Any clarification on what we want to work to as a team.
It's Complete Health with Dr. Mike Rogers from Complete Health Dentistry. When we come back, we'll find out more about what it means to be a complete health dental practice. Stay tuned.
Complete Health Dentistry, transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. We believe your mouth is the gateway to overall health. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Transforming your health for a lifetime.
You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Dr. Mike Rogers joins me in the studio. Good morning.
Good morning, Adam.
We're here to talk about what you mean when you say that Complete Health Dentistry is a complete health dental practice. What do you mean by that?
As we talked about a little bit before, I believe the mouth is the gateway to the rest of the body and the health of the rest of the body. It's the first thing that enters into an area, so it's the first thing that gets hit with bacteria, smells, odors, outside pollen, and everything else. So everything we hit usually comes first right into our face.
And then how does that? You really feel, and I'm inclined to agree with you here. It really connects to the rest of the body. And you used a great example earlier. You said when someone brings their pet into the veterinarian, and the pet can't communicate with the vet, they can't talk, or they can't say my such and such hurts. But the vet will go almost 10 times out of 10 straight to the mouth first to take a look at what's going on. And do human beings much the same?
Yes, we are. We're just a little bit different because we have opinions, and also we've got years of history on how things have been done. In the 50s, when every 6 months was supposed to be a good hygiene regimen, that was designed as a marketing ploy by a toothpaste manufacturer, and so it was to get people to buy toothpaste. And so what it was back then, it's now become standard practice. And in our practice, what we do is we design your dental needs for you, not just what's dictated by history or dictated by an insurance company, but what you specifically need.
Rather than one size fits all, it's more of a case by case.
It is, and I believe most dental practices practice that way, but still a lot of them are still caught in that insurance model.
So let's talk about some of the ways in which dental health affects whole body health. What are some other what are some other ways that the health of your mouth can affect the overall health of your body?
Well, it's amazing that the more you delve into this, and you can certainly look it up online, just Google, say, oral bacteria of the mouth, and any health disease that you want. You'll find unbelievable amount of literature now showing the direct relationship from bacteria in our mouth causing heart attacks, bacteria in our mouth causing strokes, Alzheimer's, cancer, digestive issues, and even breathing issues.
So if the bacteria in the mouth can affect the whole body so deeply, what can be done to control, to mitigate, to reverse the impact of the bacteria in the mouth?
Well, and that's a great question, Adam. What it is first you need to know, is your body susceptible to it? Do you have the bacteria that are creating the problem? And if you don't have that bacteria, then there's no need to go down that path and do something. So what we do first is we test for the bacteria, the specific bacteria. We look on slides in our office. We use a microscope to get a good feel. Is there things that we need to delve further into? And then once we go from there, we actually send samples out to a lab to be tested to find out the bacteria.
So this strikes me as something that, I don't know. I've been going to the dentist since I was a kid. I've never seen my dentist look at anything under a microscope. Is this something kind of special to your practice?
Well, you know what? I brought it out. I've had the microscope in my office since I bought the practice. I just never used it because it wasn't commonplace. But what it is when I try and express to a patient my knowledge of what's going on in their mouth, there's no way to understand the amount of bacteria we have. And so for a patient to see it, I decided to bring the microscope out of mothballs, so to speak, and use it as an educational tool and to open a dialogue. Because that's the whole point here, is I want to communicate with my patients in a way that they can get their thought process to me and I can express to them my concerns with their overall health.
And they can, you can kind of be on the same page, and it's not as if you're speaking a foreign language to them. If they can look at the screen and they can see these bacteria with their eyes, and you can say, look, this is what this is, it becomes suddenly everything makes a lot of very clear sense. I'd actually love to kind of take a step back here and have you talk about the process that a new patient would go through as they come into your office for the first time and get to know you and your staff. Because I had the chance to do this the other day, and I thought it was really valuable. I'd love if you would just kind of go through the process that a new patient goes through.
Well, in our office, a new patient, we call it a new patient interview. And what it is the patient comes in, and one of my team members will sit with the patient and actually have a long discussion with their past dental history, their medical, to review a complete medical history with the patient, and answer any questions that they are able to answer on what we do and what the patient can expect in that appointment. From there, we take a tour of the office. The patient gets to see all the nooks and crannies of the office if they choose to, from sterilization to what we're doing in the treatment rooms. And then once we have that, we go into full diagnostics, meaning we take x-rays and photos so that you can sit and see everything I do and not just look at a little bitty x-ray being held in front of you.
So actually, like beyond x-ray, regular photographs as well.
Correct.
And tell me about the x-ray. It makes perfect sense to me. Like you can see kind of inside the bone. Now, what are you looking at in just a regular photograph?
Well, in a regular photograph, there's so many things that can be seen. One, we can see, are your gums swollen or puffy? And for most people, since gum disease and gum problems don't hurt until it's too far gone, it's enlightening for a lot of people to actually be able to see full scope of what their mouth looks like from a dental perspective or from standing outside and looking in, as opposed to just when you open your mouth with your toothbrush. The other thing it does is it lets you see things that we see, failing fillings that are breaking down, that are leaking and maybe not causing pain right now. But the whole premise here is to be what we call minimally invasive, meaning keep things as small and tiny and conservative as possible so that they don't grow up to be more problematic, like a root canal or an extraction.
Sort of heading off the problems at the pass, so to speak.
Truly being preventive, and I know dentistry as a whole has always strove to be prevention.
Yep.
But what my goal is in our practice is to be prevention in the mouth, preventative in the mouth, to lead our patients to overall general health.
Now, let's just say that somebody comes in, they have the diagnosis, they have the conversation with your staff, they meet you, you have a look and you kind of find maybe something that you're not so happy with, something you'd like to address. What's the next step for the patient?
Well, in our office, it's a conversation that we have. It's one, does what we see here bother you as well as it concerns me? And then if it does, well, then we move on to treat the problem. If it doesn't, it could just be a misunderstanding. One of the big misunderstandings that we come across is, well, isn't everybody supposed to have bacteria in our mouth? Well, yes, there are, but there's bacteria in our mouth that our body can handle and live comfortably having. And then there's bacteria in our mouth that wreak havoc on our gums, our bone, our teeth, and can burrow into our bloodstream and create heart attacks, stroke, diabetes, and cancers.
So preventing these things before they become a serious issue is part of what it means to be a complete health dental practice. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Dr. Mike Rogers joins me in the studio. When we come back, we'll talk about what sets Complete Health Dentistry apart from other dental practices. Stay tuned.
Every hour, someone in the U.S. is diagnosed with oral cancer. While it used to be most commonly found in the mouths of high-risk patients like smokers, chewing tobacco users, and heavy drinkers, we are now seeing a shift in the incidence of this frightening disease. Hi, I'm April from Complete Health Dentistry of Northeastern PA, here to let you know it is Oral Cancer Month. Women between the ages of 30 and 50 with no history of tobacco use are more frequently being diagnosed. If it's detected early, oral cancer has a 90% survival rate. At Complete Health Dentistry, Dr. Rogers uses Velscope technology to screen for this life-threatening disease. He feels so strongly about the benefits that he is offering it to all patients this month at no additional charge. Take time for your health. Call us today at 253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry, celebrating 25 years of dentistry in the Honesdale area, 3-time Happy Award winner of the best dentist in Northeast Pennsylvania. Mike joins us in the studio. Good morning, Mike.
Good morning, Adam.
And we are talking about what sets Complete Health Dentistry apart from other dental practices. Now, at your office, there's a lot of things that patients will experience that they may not experience elsewhere. It's a pretty long list, and there's a lot of detail that you and your staff go into. What are some examples?
Some examples, we take a full medical history, and we relate how the mouth relates to that medical history. And if there's things that we see from a dental perspective, since the mouth is related to the rest of the body and can contribute to the health issues of the person. So we really delve into how the mouth can relate to that. The other thing is what we do is we sit with the patient and discuss what we call a healthy mouth baseline. And what that is what is ideal dental health, if nobody's ever discussed what is ideal dental health, and then what we can help you with to get you there. From oral cancer screening to TMJ, jaw joint issues, which can create headaches and facial pain and even numbness in the hands.
So this is not necessarily, the brightness of your smile, but this is actually a whole body health issue that you're addressing. It's simply the hinge of the jaw. Is that right?
Correct.
I've been going to the dentist since I was a kid. I don't think I've ever had my jaw examined by a dentist, but this is just part of the regular practice for you.
It is, along with that, because we do blood pressure screenings on every patient. We screen oral cancer, as I said. We do salivary testing to check the bacteria. What we also do is we screen for sleep.
What do you mean by that?
What it is sleep apnea or sleep deprivation or oxygen deprivation when you sleep. It creates a whole host of medical problems. And in dentistry, we can create dental appliances if a patient cannot wear a CPAP, because that ultimately is the best way to treat it. If they cannot, or they're CPAP intolerant, they can't or they won't wear it.
So the CPAP, I'm sorry, for folks who have just heard of this for the first time, the CPAP is the sort of mask that puts sort of positive pressure against your mouth and diaphragm to help you breathe easily at night, right?
It pushes oxygen into your lungs.
But for some people, you're saying that mask is, for one reason or another, they're not able to wear that.
Correct.
So in that instance, you can help?
Yes, we can. We can make it a dental appliance that you wear comfortably at night while you sleep. And I made it a part of my life to really screen for sleep, because or airway issues. Airway issues can start usually as a child, and we screen children for airway issues, which could lead to crooked teeth. It could lead to bedwetting. It could lead to all kinds of other health and future medical issues, along with having dental and jaw problems because of growth and development. So we can screen all of this for your kids, evaluate that, move them through interceptive orthodontic treatments, meaning put things in the proper position, open airways. I work with a lot of ENTs, ear, nose, throat doctors, that we're on a good first-term basis, so that if someone's coming from my office and I really believe that there's an airway issue, they're able to get them in and see them and evaluate them. Do they need tonsillectomy or nadoidectomy that can open these airways, along with just changing the position of their bite?
So the mouth, you've been saying, and I'm really understanding what you're meaning now. The mouth is the sort of the first line that encounters the world, and as a result, it can be one of the quickest ways to ascertain whether or not a certain problem exists. You were talking also that you screen, you do blood pressure for your patients when they come in. What's the purpose of that?
Well, blood pressure is multiple fold. One, it helps us decide what type of anesthetic. The general term is Novocaine to use. It also is because a lot of people come to the dental office 2, 3, 4 times a year, and they may see someone in their medical community once a year or once every other year. And so having multiple screenings throughout the year can eliminate a whole host of problems. It can eliminate a cardiac event in the future, or find underlying problems that you may not see if you don't get this checked on a regular basis. Also, another thing that it does is it's an indicator. If your blood pressure is high, it's an indicator for diabetes. And so there too, it's one way that we can help you get back to your physician, because that's what we try and do, is partner with you and your physician so that we keep you as healthy as possible for as long as possible.
It's becoming more and more clear to me that Complete Health Dentistry is not just a clever name. It really is a way of doing business, a way of approaching the whole health of a human being. We're just getting towards the end of the program now, but I wanted to ask you if there's anything else that you wanted us to touch on here on the first episode of Complete Health.
You know, one of the biggest things is in medicine and dentistry is our body can only fight things using its defenses, and that's what we term as inflammation. You get a cut and your area gets inflamed. You get a bruise, that's inflammation. If you're diabetic, that's an inflammatory response to the blood sugars. So what it is that's going on here is, if you've got bacteria, if you've got problems in your mouth, if you've got inflammation in your jaw joint, if you can't breathe properly from sleep apnea or just growth and development issues because you need to be seen by an ENT and address tonsillectomies, or you're breathing through your mouth on a constant basis, that's all creating inflammation. As inflammation builds, our body's defenses break down because it can't fight everything. And so that's where we start to see all these extra problems show up. Diabetes, heart disease, cancers, things like that. So if we can catch this and eliminate inflammation at the beginning, and where it's sitting 24 hours a day, just seeping into your bloodstream, and that's in your mouth, the bacteria there, if we can eliminate that, we can get you healthy, keep you and your family healthy, and around for a long time.
And one more question before we close out, and I want to make sure we get some contact information out there for listeners who might wish to set up an appointment to come in for a screening. If somebody is nervous about a trip to the dentist, if somebody has some nerves about being in the dental chair, being worked on, having their mouth examined, what can you say to them to kind of allay those fears?
Well, in our office, we do multiple things to eliminate anxiety and fear. One, we do believe in essential oils. We have them diffusing through the office to help calm and soothe patients' emotions. We can do sedation if patient is that apprehensive to come to a dental office. But the first visit is just, let's sit down, let's get to know each other, let's look at the whole picture. And that's really what it comes down to. Since the mouth is the gateway to the body, we're going to open that gate and look at everything and just be able to go from there and say, okay, maybe this is the reason for an underlying problem that we can't figure out what's going on for.
So let's give out some contact information for folks who are interested in coming up to set up that first meeting with you and your staff.
Well, you can certainly call our office. If this sounds great for you, call my office and talk to one of the people there. 570-253-5000 is the office number. Or you can reach us on the web at Complete Health Dentistry of NEPA.com.
You've been listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. Call to set up an appointment, 570-253-5000, or go online to Complete Health Dentistry of NEPA.com. Dr. Rogers, thank you for being in the studio with us today.
Thank you, Adam.
Complete Health Dentistry.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Transforming your health.